We're going to continue now to talk about other diagnostic tests that may be used in their lab values. So a BUN is known as a blood urea nitrogen, and we use that to determine proper kidney function or renal function. Urea is a chemical that's formed by the liver. It's a non-protein nitrogenous end waste product that is a product of protein catabolism, or the breakdown of proteins. Um, a normal BUN value is 7 to 18 milligrams per deciliter, or 2.5 to 6.3 millimoles per liter. So we would look at this BUN and determine, are the kidneys functioning properly? And that would help us know if drugs and medications can clear the kidneys properly. So again, table in your book, an increased BUN could be caused by a heart attack, gout, dehydration, diabetes, medications, pregnancy, and the signs and symptoms generally could include confusion, convulsions, or disorientation. A decrease in BUN could be due to a diet that's low in protein but high in carbohydrates, medications, fluid overload, liver failure, kidney disease, and the signs and symptoms may include edema, as well as things that are more specific to a disease state. Another lab value that we need often includes electrolytes. So these are the salts in your body um, that help the muscles function properly. So, remember we talked about calcium, potassium is an important one, sodium is an important one. Um, Electrolytes are crucial for proper cellular function throughout the body, and the body must maintain the normal concentrations of these electrolytes. Also helps maintain our fluid balance. The amount of water in the body, either too much or too little, can affect the electrolyte concentration. So again, another table in your book. It gives you the different electrolytes, and if the lab results come in, what could be the cause and what are generally the symptoms associated with it. So starting alphabetically with calcium, calcium has an elemental symbol of capital C lowercase a. And as an ion is a particle that is charged. Calcium has a +2 charge. The normal values of calcium should be between 4.5 and 5.4 milliequivalents per liter. Your electrolytes are generally measured in milliequivalents. Later on in the pharmacy program, as we move into the associates level courses that'll be starting within the next year or so, we'll go into the milliequivalent part of it a lot more. But at this point, it's just a unit kind of thing. But we will learn more about it in the future. An increased calcium can be caused by diuretic therapy. That means that we're using medications to increase our urine output. When we do that, it takes fluid out of our body. But what happens is some of those other parts that are in the urine don't go with the urine, so they stay behind. So it leaves the calcium in the bloodstream, and because there's less fluid, it makes the levels look elevated. It could also be due to excessive consumption of antacids or milk, things that contain calcium. Hyperparathyroidism, which uses the hormone parathyroid hormone to bring calcium from your bone into your bloodstream. Could be due to tumors, and it could be due to vitamin D intoxication. Increased calcium signs and symptoms can include loss of appetite, constipation, lethargy, mental deterioration, renal stones, kidney stones, as well as weakness. Decreased calcium could be caused by pregnancy, hypoparathyroidism, or vitamin D deficiency. Vitamin D is important for the absorption of calcium. Signs and symptoms can include muscle cramps, paresthesia, which is kind of like a tingling all over, mental disturbances, as well as convulsions. The next electrolyte is chloride. Chloride is an anion. It's missing a charge, so it is elemental symbol capital C lowercase l with a -1 charge. The normal values for chloride are 95 to 103 milliequivalents per liter. An increase in the chloride can be caused by renal tubular acidosis, and signs and symptoms include rapid breathing, deep breathing, disorientation, and weakness. A decrease in the chloride ion is generally caused by excessive vomiting, and signs and symptoms can cause shallow breathing, muscle hypertonicity, and tetanus. So, kind of like a muscle paralysis, or your muscles freezing up on you. The next electrolyte is potassium. Potassium is an ancient word called kalemia, Latin word, and that's where the elemental symbol K comes from. It is a cation. It has a positive charge. The normal values of potassium are 3.8 to 5 milliequivalents per deciliter, and increased potassium can be caused by muscle tissue damage and renal failure. Signs and symptoms may be diarrhea, nausea, a ventricular fibrillation, irritability, and weakness. Now, a note about potassium's level, that 3.8 to 5 milliequivalents per liter, that is a narrow range, and excessive potassium actually can cause arrhythmias, and if they're too excessive, they can cause the heart to stop. Decreased potassium levels can be caused by diuretic therapy. Generally, with a diuretic, it pulls sodium and potassium, so it can deplete the potassium. Diarrhea, endocrine disorders, chronic stress can also cause a decrease in the potassium levels. Signs and symptoms can include, again, arrhythmias, hypotension, muscle weakness, and a general malaise. The next electrolyte is sodium. Sodium is old term natrium, which gives it its elemental symbol capital N lowercase a with a +1 charge, or a cation. The normal values are 136 to 142 milliequivalents per liter. An increase of sodium could be caused by dehydration. Less fluid leaves the salt behind. Signs and symptoms can include a dry mucous membrane, dry tongue, intense thirst, and flushed skin. A decrease in sodium can be caused by excessive water intake, loss of GI secretions, excessive sweating, and suffering from burns. The signs and symptoms of a decreased sodium, include abdominal cramps, muscle twitching, confusion, seizures, vasomotor collapse, and a decrease in perfusion, the blood circulation. In addition to electrolytes, we can measure enzymes in the bloodstream and in the body. Enzymes are complex proteins that create changes, usually speeding up processes without changing them. Normally, without changing the enzyme. It's what we call a catalyst. So a catalyst in a reaction can increase the rate of the reaction without actually being part of the reaction. Enzymes are normally found inside of body cells, and then when there's tissue injury or cell injury, then it can sometimes change the levels of those enzymes. So those certain enzymes can be noted in blood or released and following the injury or death to a cell, like in a heart attack.